Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we're moving into our first conversation for this morning. We're joined by the Director of Health Services at the Ministry of Health, Dr. Marvin Manzanero. Good morning.
Good morning, Doc.
Good morning, Marlene. Good morning, Isani.
All right, Doc. Well, thank you so much for joining us for our COVID-19 update for today. There is a lot to discuss, but let's just start off with your assessment as to where we are currently.
Well, two things. If you go back exactly 1 week ago, we are starting to have significant or a sustained number of cases being detected on a daily basis. Through the weekend, I believe Friday, Saturday, we also had the same issues that people would have had in terms of some people not being able to access health their workplace. I mean, you're talking about Western Regional Hospital perhaps not having all their staff. Carlution, the same thing. Same issue with Central Medical Lab because some people had commuted to Cayo, and so we had lower amount of tests being done on Friday and Saturday. Compile that with the fact that we had an unusual amount of, the flights that didn't come on Friday, I believe, came on Saturday. So you had staff there until like 8 p.m. on Saturday, clearing up, because after people have left, there's still the quality assurance issues you have to deal with at the airport. Through the weekend, also an increasing number now of patients requiring hospital care at Carlution. Not necessarily at the regional level, but we're starting to see the numbers come in one by one.
So let's start to break this down. You're talking about increased number of patients and increased number of hospitalization. I don't have a visual in front of me, but if you were to say if we are still growing in terms of our cases, or are we plateauing?
No, it's growing. Actually, the graph that is plotted on a daily basis with for example, by you, it does is actually, you can see a small spike towards the middle of last week. So that is growing. Right? There's no plateau right now.
Okay. What do you account from the Ministry of Health point of view for the constant rise in cases?
Well, you would have to ideally be able to sit down with the communities and determine why it is that they are not accessing health services. For some communities, it is easier than others. In Orange Walk, it's still a situation that we feel is being driven by social components. We still see people who are visibly ill, or who we are told are visibly ill, and who don't actually go and take or seek care. We have had a couple of people die where people refuse to be referred to Carlution, even though they met all criteria because they are critically ill patients and they refuse to simply be transferred. It's a different dynamic that I think people are able to make that decision, and then they die at Northern Regional. The patient that died yesterday, for example, the family reported him. He had all the pre-existing conditions: diabetes, obesity, hypertension. Family reported that he had been ill for at least 3 days, and he just never sought any medical care. When he arrived, he was pronounced dead on arrival. So those are dynamics that are telling you that there's people not accessing the services. So they have been ill for days, and they might be spreading the virus to others, so there's an ongoing sustained community transmission. For the rest of the communities, yes.
What can you tell us about the second fatality over the weekend with the 25-year-old? Because we would say very easily that's a young person who, for all intents and purposes, may have been a healthy young man.
Yeah, well, our understanding, because that person had not actually been seen within the public system. He had been swabbed in the public system earlier in the week, and our understanding is that he was undergoing a medical procedure at a private facility in Belize City. So we are going to reach out to the private facility and determine what exactly happened or what procedure he was undertaking, because he was taken to Carlution and he was pronounced dead on arrival. So we are not so sure what kind of procedure he would have been undertaking that would have contributed or be the cause of why he died. But he popped up in our system because he is a positive case, and then you go and try to identify where the patient is, as part of. Then you realize that he had died undergoing a procedure. Whether he had actually told the private facility that he had been swabbed and was at risk for COVID-19, we don't know. I mean, we have to see the report. That's why we weren't able to provide details yesterday.
When did this person die?
I believe it was on Thursday.
Oh, so that's a really interesting, because if he had tested positive through the Ministry of Health, unless he was accessing services as a result of complications from COVID. Okay, one second. Pause. Okay, we're having a bit of an audio problem here. Guys, all right, can you try again for me, Dr. Manzanero?
Services, it seems that in private sector, again, they will not have necessarily alerted us, unless people have a COVID-19 situation. He was undergoing a medical procedure, surgical procedure, as we understand it. So we have to find exactly what happened. He was swabbed in, so it's not that he was swabbed in Belize City and the procedure was being done in Belize City. Okay. So we have to find out exactly what happened, how you get from point A to point B, and then how he shows up and is pronounced dead on arrival at Carl Houston.
How concerned are you by what you're seeing in the country at this time? I mean, the message is out there that COVID is a threat, that we need to keep our distance and not interact with other persons without masks and social distancing. We look at nomination day and what happened there. We look at what's happening with the floods as people are trying to get out just as a matter of saving their lives. And then we have the upcoming election day. What is your projection for us moving forward?
I think we're very, very concerned, even before you get to elections. I mean, we are at the point where you eventually will have to start to make determinations in terms of people and access to ventilators, and I don't want to hear that. But as I said, Carl Houston already had 13 cases this weekend. And if you start running out of space, and of course they're looking at their spillover plan, which can go up to 28, but through the weekend they had up to 23. Belmopan had 4 or 5 patients. Corozal had, I believe, 4. Just yesterday, Orange Walk had 2. And so once those patients start requiring hospital care at Carl Houston, there is no space and you have to do the spillover. Now, even if you do this spillover, if you go more than 28, you will require more and more staff, and you just don't have the staff. There's only a limited amount of staff. So critical decisions will have to be made. Unfortunately, I think it's going to boil down to that. Once you start having your capacity at the hospital overwhelmed, and which is what we were trying to avoid. As from the health standpoint, what you try to do is avoid overwhelming your health system. Understanding that COVID is here, I understand the election process. I think we are even more concerned before we even get to elections, and that's only 2 days away. But at the rate we are going by this weekend, we could be having serious problems in terms of hospital capacity everywhere, because it's staff is now starting to fall ill. Our health staff, I just got a note that a public health nurse from Orange Walk is now positive. One of the doctors who works at the flu clinic in Belize City is positive. One of our healthcare workers from Cayo is at a private facility in Belize City, hospitalized. So once you start having more and more patients, and even if you have the beds and you don't have the staff, then that can spell a lot of complicated situations for patients.
Dr. Manzanero, I think people will watch this, and I want to be very clear. When you talk about a protocol, we saw this in some countries before, where a decision has to be made at the onset. If you are perhaps elderly, if your chances are slim, then you are not given first right to the ventilator. It's a protocol that's put in place that doctors use to guide their decisions. You're saying that we are close to that. My question is, we are, 4 months behind the rest of the world in reaching this critical phase. Have we done enough to mitigate the situation that we don't have to make these life or death calls with people?
Well, I don't know. Well, it's a growing situation. I think everybody would have to do now more. But you see, we saw this kind of cascade start to happen. We started a situation in August, had a small dip beginning of middle of September, and then it started to go up. And we did say the 10th, the 21st, the long weekend in October, and you start seeing it. But at the same time, with even the comments we get on social media, it doesn't seem that the message is out there or that people are that much concerned. People want to know what kind of medication you're going to be able to take or give people once you start having what you're having, and there's none. Even the flu vaccine that is there and is widely available, I don't know that the uptake has been significant, and you would want that to try to help you mitigate, as you say, the potential.
I guess just to interject there, my question, and I hear you on the community or the public's behavior, but I'm asking from the Ministry of Health standpoint. We saw this happen. We saw the overcrowding of hospitals. We saw healthcare workers getting infected. We saw the concern about creating what they call the death protocol, who gets treatment and who is sent home to essentially pass. We saw these happen months ago in other countries. What steps did we take locally that, knowing we could potentially get to this point, that we were going to reduce our chances of having to make these type of decisions?
Well, I think the protocols in terms of where the ministry is and where Carlucia is, they are there. What your bed capacity is. We had that discussion at the board meeting at Carlucia. We know what the capacity of the health system is. We said what the bed capacity was. So you try to avoid people getting there. The fact that you're trying to manage the patients at the regional level and avoid them being transferred, doing whatever mechanisms you have in place, they are there. But understand that as long as people continue to move out there, people are going to be fed into the system eventually. And that's not counting all the people that have just not accessed healthcare, as you have said. So it's not really a mitigation plan. I think now it's a mitigation plan, but you're in a containment phase where you're trying to contain it from getting to where we are now, and the numbers are just going.
Doc, I look at the fact that you have all of these frontline personnel who are responding to the flood situation, and they themselves are exposing or risking exposure in being able to reach out to these persons who are affected. Do you have preliminarily perhaps, or maybe as an update, where we are in terms of frontline personnel who are afflicted by COVID-19 at present?
The active cases I wouldn't have, but we usually do that once a week. But I think even in terms of the flood mitigation, you might have other frontline workers, because I think they take out social workers and public offices to man shelters. Those are not routinely captured in the infographic we have. You have to do an active search for that, because our infographic is going to capture, police officers, BDF, healthcare workers. It's a different cadre of staff that you would need to do for that, just like for elections.
Yeah.
So, when you going back to the hospitalization, would you say that we are at the capacity?
Not yet.
What percentage?
Well, we had, as I said, Carlucia had 23. I believe they now have 22, with 2 possible discharges today. So you're talking about Carlucia at least being at 75% of their current hospital capacity. And if you run beyond 28, then you're talking about different levels of or areas that we had not previously exported to have to be taken up.
So you're looking at 28 definitively, at least at the National Referral Hospital here. That's number of persons who can be accommodated. But let's talk about human resources. What's the capacity of the team there? How many people can they adequately treat if they're in a very critical phase?
Well, the number we gave, because I know that at the board meeting we had on Thursday, we were trying to see what other areas of the hospital could potentially be used if you go beyond that.
Yeah.
I'm very cautious in my discussion and advice to the board in saying, I don't know that we want to go down that road, because if you also don't have the resources, then you're just really having a bed, and that doesn't make much of a difference. So I think we want to keep that number of 28 is a number that you would keep and be able to manage in terms of human resources.
Doc, you're essentially at a transition period at the moment with the dissolution of the National Oversight Committee last week, and of course the succession of leadership in government. What has the decision-making process been like for the Ministry of Health at this point in respect of its COVID response, not having all these ancillary bodies lending support?
Well, I'm glad you brought up that discussion, because at the last Oversight Committee meeting on Monday, I think from the Ministry of Health standpoint, we really have to be appreciative of the support we got from Prime Minister Barrow. He was always attentive to the scientific evidence that we would present every Monday, and I think he was very mindful of the decisions we wanted to take. So I think there was a lot of respect for decisions we brought to the table. I can't tell you that everything was taken the way we would have wanted, but we were allowed to present based on science. We were allowed to guide based on science and the evidence we had, and I think you have to appreciate that you are not going into a weekly meeting to have a fight, but rather to be listened and to see how, based on the decisions we made internally, that those were going to be taken up. I think we had the same level of support from all the members of the NOC. So basically what we are working on, and I think at the last NOC meeting we were asked whether the Quarantine Act would allow us to close down, if we had to close down any entity, if there was enough legal backing for the Ministry of Health to make decisions. And so that's what we are relying on, the Quarantine Act. So it's basically the internal team making decisions from the health standpoint, understanding that you might not be able to influence the other sectors. I think we still can reach out to them. Chair of the task force, because people also, I don't think, understood the composition of the NOC. But there was a member from the business community, there was a member from the NGOs, there was a member from the Council of Churches. The chair of the task force sat at that meeting as well, and there was a member from the NTUCB. So those were the four critical members that would, because that's the way it worked, is we will always be the ones to present based on the evidence, what had happened during the week, and then decisions taken based on that. Yeah. And we will always have an opinion as to where the decision was going to go. So basically it's us being able to make health decisions only.
All right. Let's shift gears now to elections day itself. I know you were consulted, or the Ministry of Health was consulted in creating the COVID protocols. Tell us about some of the things that you want to remind people of. Do you feel that the safeguards in place are sufficient to protect us from a super spreader event?
If we all do what we're supposed to do, and that's the trick part, because if we all do what we're supposed to do, we wouldn't be where we are now. Yeah. But I mean, it's human nature. Two layers of concern. One is the public officers working, and I think that there's enough evidence, and we have had two discussions, I think, with election clerks and the people working with the responsible in each division for conducting the election, to explain to them what mechanisms could be had so that they take care of the election officers working that. And the concern for, and I think Mr. Mai is going to address it to you later on, is the public officers that are now saying that they're having a pre-existing condition, and that's the reason why they should not work. Okay. And I'm starting to see a number of sick leaves being sent, and I don't know that that's enough justification. And I'm saying this as a clinician, as an internist. I am not necessarily seeing that the fact that you are diabetic means that you will not be able to work if you take all the necessary precautions. So that's one layer. The other layer is for the voter, and I have said it and I will say it again. I don't think that going to vote should be putting you at putting your risk there. If you just go, stand in your line, wear your mask properly, vote, go through that process of identifying yourself, showing your face, because even if you take your mask just so that people can see you and then putting it back on, putting your finger in the ink, going to get your ballot, and putting the X wherever you want to put your X, and then leaving and going home, that in itself is a minimal risk situation. So that should not be a concern. I think the concern for us is the mingling of people, the fact that people will want to linger around the election areas as traditionally happened, or the fact that people set up tents around the election, around the poll areas. Those things should not really happen. I mean, those are, I think, are the potential situations that can spell trouble. We will look at it, and then I think if there's a lot of that happening, then I think we can brace ourselves for what that major surge that will happen 2 weeks from now.
Okay. And I just have one final question. It's a follow-up on a previous issue. When we had the first pediatric death in the country, there were a lot of concerns about how it was handled. I understand from your previous interview that you're saying there should have been a protocol in place. You spoke of being in contact with KHMH. Have they addressed how they will handle pediatric cases of COVID from this point forward?
Yeah, it will have to be done also on an individual basis. I think that's also understood, because if you have somebody at pediatric case that's intubated, then that's handled totally different than somebody who is not intubated.
Okay, back it up for us and tell us, should a parent or a loved one be allowed to be with their child when they're in the COVID unit?
It depends on where exactly you're in the COVID unit, because understand that the COVID unit is not individual rooms.
Yes.
If you have 6-8 patients in one area, then you will understand that it's difficult to have an adult in that area, simply because nurses are moving. I mean, or even the flow. And even if you put anybody in there, then you're thinking that if that person is negative, then you're going to have to sacrifice somebody. So as I said, it's going to be handled on an individual basis. Where possible and if needed, you put them in a separate room. As has happened with moms who have delivered either by C-section or normal delivery at Carl Houston, where they are able to keep the baby with them. So that, I mean, it can be done on an individual basis.
So you're looking to have a special room for pediatric cases?
Yeah, well, assuming that you only have one by one, because once you start having more than one, then another layer of complications comes along.
All right, and closing thoughts, Dr. Manzanero, as we proceed and understanding, just one more thing. We have two situations that have been hotspots repeatedly. We've spoken about Orange Walk, we spoke about Corozal. But when you look at the current active cases in Belize City is very similar to that in Orange Walk Town. Tell us about the emerging areas that you're seeing at this point.
Well, the ones in Belize City were initially driven by clusters. Once you start seeing it go out of those clusters, and you're talking about community spread. So in Belize City, it's primarily work persons that would have usually come from Orange Walk as the initial clusters, but then at work, and I get asked yesterday on social media that it seems that at work, that we're not concerned about people at work or people commuting to work. Well, the commute has not been shown to be a consistent way of people getting infected, but it's at work where people would come to work, mingle, and not adhere to the social protocol. So the general sense we are getting is that people, once they get to work, are not wearing a mask properly. When you look at all the clusters being driven at work, it's usually people who will tell you that they let their car down at work, and that's the reason why they would have. So you had 3 major clusters well, not major, many clusters, but then you start expanding them. Central Bank was one, the post office situation, and the magistrate court, what given rise to. Once you have 5, 6, then you have to start multiplying it by 4 or 5, and that's how you start getting your numbers up in Belize City.
So are you saying there's community spread in Belize City?
Well, we haven't seen sustained ongoing transmission where people don't know where they got it from. Most of the time, they are links to somebody they know,
okay.
As opposed to Orange Walk and as opposed to Corozal, but more so in Orange. There's definitely a good amount of people that are saying that they don't know where they got it from.
All All right, well, that's all the time we have for today, so that's all we can fit in. But thank you very much for providing this update this morning. We appreciate it, and we must definitely, we need this reminder to keep us going with all the efforts that we have to make on our part. Thank you, Dr. Manzanero.
Thank you, Arlene and Sunny.
Thank you, Doc.
We're going to go ahead and take a break now. When we come back, we'll be focusing on the flood situation. We'll be talking to NEMO about what they're doing and where they're preparing. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.